strategic advisor, Fiore Ventures, for a discussion with Robin MacIntosh, founder of Avela Health.
Hey, this is great. So good to be with all of you today. Thank you so much. My name is John Bailey. I'm with Fiore Ventures. That's a early stage venture capital firm that's backed by Carrie Walton Penner. She's the owner of the Denver Broncos, which I know is a little sensitive to say in these parts. But she cares a lot about youth mental health. And I'm in conversation today with one of our favorite founders, Robin MacIntosh, who's got this amazing story and background. She's literally started 4 companies and got her start as a designer. And so maybe we'll just start from there. Tell us a little bit about your journey and what led you to start Avela.
Sure, yes. It's so nice to be here, and thank you for having us, TK Ventures. So I got my start in a really non-traditional way. I didn't get an MBA, or I didn't have that kind of pedigree. I got my start from design. So I went to school twice, once for creative writing and the other time for design. My parents were really happy about that. And when I was in school, I took on a lot of projects. But at the same time, when I was in grad school for design, I also was getting sober. So I've been sober for 18 years. And
Yes.
I love to give myself like a slow cut for that. But no, I'm sober for a really long time. And I started to get really, and I come from a family of clinicians as well. So I was always very interested in healthcare and how health winds through the fabric of all of our days. And I like life and death and the drama of it. So I was always really interested. So I took on a lot of projects in design school. And when I graduated, I worked at IDEO for a little while and learned a lot of kind of the founding principles of systems change and innovation and those kinds of things. And then created a design studio where we worked with a lot of Rock Health companies. And Rock Health at the time was incubating. And you are a supporter of Rock Health.
That's right.
We just went to that conference. But Rock Health was incubating a lot of really interesting kind of the self-driving cars of healthcare at the time. And I was also in AA. So I was going to these church basements and this bad coffee and thinking the center cannot hold. This is wild. And it was before the opioid epidemic and I think as a designer, we're always looking at the world and looking at systems and trends and being, trying to kind of see around corners. And so I knew it was going to be a big deal. And I knew it was going to hit the United States really hard because so many of my friends were dying. And, and I say that kind of in shock at myself. It's kind of a wild lived experience. So I created a company called Workit Health and started an addiction. So I did that for 10 years. It was incredible, applying a lot of basic design principles to business, and then used all of those learnings from Workit in healthcare and learnings from the design degree, cross-pollinated it into autism care.
What was it about autism? Was there a personal connection, or so much lived experience seems to have fueled your entrepreneurship and what you've founded? So what was the personal connection into autism?
Yes, I tend to get really obsessed with my companies and really obsessed with the problems I'm solving. And so it really helps to have lived experience because it becomes my whole life, And so it's helpful to work on something that I know directly applies to my family, really. Addiction, autism, et cetera. So I was the CEO of Workit, working 60, 70-hour weeks, and I want to get into a little bit more detail than I usually say because it so ties to the design of Avela. And so I was working really hard at Workit, and my oldest daughter was really suffering, and she was suffering in a way that looked very similar to my nascent addiction at that age. So she stopped eating, and I have an eating disorder as well in recovery. But it was brutal, and I was really scared, and pretty quickly in the autism world, 6 months in, after sitting on a wait list, we were able to get a diagnosis. And she sits in that category of autistic kids that I hate when people say high functioning or level 1 or 2. I just think it's all so arbitrary because it's such a heterogeneous condition. But she was really, really struggling with not just behavioral, but she was struggling with developmental issues. So she was a lot of self-injurious behavior, et cetera. So we were put in what we were recommended only one thing, which was applied behavioral analysis, which is great for some kids. For Peach, it was really, really tough. So we were put in 30 hours a week, and our health plan, thank goodness, paid for it. But I left my job, which is we're seeing a lot of support and talk around caregivers, but it was such a brutal thing. And I felt like I was coming at this with so much privilege. So I had to leave my job. It was such a bleak process. Like you couldn't find your way through the maze. Services were being thrown at you. At the same time, this wouldn't have been enough to start a company, especially after leaving Workit. It had been a decade, and I was ready to like kick my feet up and do something else, something else, or just not do anything at all, John. But then it was so interesting. I was just telling someone beforehand, it was so interesting. I'm such a nerd for healthcare, so I love to examine my EOBs, like what my health plan pays
who
for.
doesn't?
Yeah, who doesn't love that? Especially with AI, like you can really analyze. And so looking at the bills, what my health plan was paying for our care was around $20,000 a month. And you compare that with something like Workit Health, where we become the primary medical home for our opioid use disorder and alcohol use disorder patients, $1,000 a month. So that differential is massive. Workit, we have, it's a life and death thing. If somebody gets cut off from Workit care, you have to look at a sentinel event. Like it's really extreme. With autism care, it's different. So the differential was so high. Then I did something that I normally don't do. So instead of kind of rooting through the problem of autism from a desirability lens, like, will people want this? I went right to the health plan. So I went to a health plan partner, a bunch of them, but we found a partner that would sculpt a product that was value-based care to lessen kind of the spend and to change some of the resource utilization within a health plan.
Okay, so you said a lot there to unpack, but I want to start with 6-month waiting list.
Yes.
And then care that was prescribed or assigned that wasn't really customized to your daughter's needs, and then also high cost. And so that sort of shows some of the brokenness within the care market. Tell us a little bit about the care model that you're pioneering with Avela.
Yes, it's so interesting. Actually, it's really similar. It has echoes of addiction care. When I was getting sober, the only option was inpatient rehab. Nobody would entertain anything else. It was just inpatient rehab or nothing. Similar to this, when you go through this process as a family, you're told to be put in one type of care, and it's a high intensity, long duration. So when you ask like how many hours, you start at 20. You start at 20 hours. Actually, CASP just released guidelines saying that we have to start at 20, even though the scientific literature, just a juicy space, like even though the scientific literature tells us that you don't need that for every case, right? It doesn't make sense to have like a one-size-fits-all for such a heterogeneous condition. So you have this high intensity, high duration of care. Health plans are, up a creek kind of, excuse my language, but like, what is the health plan gonna do? Keep paying $50,000 to $60,000 for a spend for one autistic kid, and then no one can access resources. So I love business too, and so you have a really interesting model. You have an interesting, very depressed supply, very high demand, and federal regulation that demands more supply. So it's just fascinating. So we went to our health plan partner, and we basically said, if we could do something virtual and cut the cost, how much would we need to cut it in order to enter your network and to move the needle? And so we started designing with the health plan, and it was so unique. So we designed a model that on the front end looks very much like a concierge model. So every Avela family comes into Avela, and this is all powered by AI in the back end. So we keep our panel size very low. So in fee-for-service, you push productivity, and probably everyone knows this, but you push your clinicians for productivity. My sisters would like destroy me if I did that at one of my companies. So and we kind of got up that route with Workit because of the fee-for-service model, and I thought it was an interesting first discussion. But with Avela, all the panel sizes are really low. So you have a PhD or master's level clinician, and that clinician can either be a child psychologist or BCBA, or we have a variety of clinician types to answer the workforce shortage. So, and that person is your all-you-can-eat kind of concierge person. They're your go-to. So you're streamlining all of your care through one person. So it's a really simple design on the front end. On the back end for health plans, through AI and a bunch of optimizations and through co-pilots, et cetera, we're able to cut that cost. We're able to cut that cost through a value-based model by 75%. We just released our first 6 months. I have to tell you that, actually. John's an investor of mine.
Good investor update here. Real quick, I mean, it's amazing. But also, I mean, before we get into AI, talk a little bit about how you've leveraged your designer background, the IDEO background, and how that's applied into thinking about these services, and then also how that's being applied to thinking about how to leverage AI too.
Yeah, of course. Yeah, AI is such an interesting conversation topic, and I love all the lenses we all bring from our interdisciplinary background. So at IDEO, I think in the world of design, you have a lot of innovation frameworks, but the one that I like to deploy against company building it's quite simple. So if you think of a Venn diagram, you have this kind of Venn diagram with innovation in the middle. So you have desirability, so do people want your thing? Viability, will people pay for it? And feasibility, is it scalable? A lot of founders 10 years ago, 15 years ago in behavioral health, I think forgot desirability. Now, and I think this echoes in the first conversation we heard, now I think that we've kept an eye on desirability. We know people want it, too much so, right? Like if you optimize for desirability and not clinical quality and the other, I always add clinical quality as like my fourth circle, but if you optimize too much for desirability, then you look like kind of a runaway train, right? Like you forget safety and feasibility and those kinds of things. And I think we've seen that. We've gotten really messy in digital health. Embarrassingly so, I think some of the companies, but now it's like tightening back up. So with Avela, it's kind of the question, do people want it? And I already knew the answer there because I had talked to so many families like mine that said, like, this is not a fit, but it's the only option, so might as well do 30 hours. So desirability. Viability in healthcare is actually quite difficult. Who will pay for it is quite difficult because it's hard to get a payer to sit down with you and co-sculpt a solution. I mean, unless you're a big name, unless like you've done really well and you're a huge provider, and then even then it's sort of, people go at it with this like kind of bombastic animosity where they're like, it's a negotiation of rates. You're arguing for the wrong things instead of like saying, hey, you have these desirability problems. Families want X. Right. You want cost savings while keeping your quality really high. How can we co-design something that works for both sides? Yeah. This is employers and plans. So we worked really hard on viability, and so we'll be profitable in a couple of months. And we started a year ago, which we're trying to prove out this different model as well. So that's another thing, the self-sustaining piece. I really want to build something sustainable. I don't think it makes sense to continually in startups borrow from the future and continually just sit on these burning platforms and call that great care. Like that's just not, it's so short-sighted. So I think a lot about viability. And then of course, feasibility with AI is incredible. So feasibility is, can it scale? So a lot of people have a hard time getting to like the 5 million mark, the 10 million mark, the 20,000 patient mark, and we passed all of that with Workit. So I know firsthand what it's like to build a virtual intervention without AI. And now I know what it's like with AI. And like, I like the latter.
What's different? What is different this time around with AI?
I think the biggest thing that I see, the biggest opportunity beyond, you and I have had a lot of conversations about this, but AI to me is like the internet. It's ubiquitous. It's everywhere. It's in all things. It's the internet, right? Like it would be strange if you didn't have an e-commerce site, or a website. It's just like it would be strange if you didn't have any AI tooling in the back end. So instead of focusing so much on kind of the operational busy work, like of course it can reduce admin times for our clinicians. That's not a novel thing. So can all technologies. Like when the vacuum cleaner came about, like that's the promise, more leisure time for human beings. Now, I've used AI to think about clinicians being able to do something that in medicine and behavioral health we've promised for a really long time, which is precision medicine. And in behavioral health, it's like extra. I actually heard someone talk on stage at Solome's at BHT last year, and he made such a good point. I actually think he's here, but I'm going to go up to him afterwards. But he made such a good point. He talked about he just talked about how blurry the outcomes were in behavioral health. Now there's nowhere to hide. There's no excuse in some ways. Autism is a great example of every condition. It's a heterogeneous condition. So is addiction. Like behavioral health, the DSM criteria like what it is a cluster of behaviors that you wrap a definition, that you wrap a label around. So that cluster of behaviors can be driven by a lot of different things. It's really heterogeneous. One autistic kid, like my daughter, looks really different from, a non-speaking autistic child, or, and I look like a different parent with my set of traits, et cetera, right? Like it's heterogeneous. So AI allows our clinicians to spend more time thinking about their families and less time doing admin work while keeping the panel size the same. I don't use it to like pump productivity out of my clinicians.
Yeah.
I really use it to give them more space for what I think of as atomic level tailoring. Like now you can remember that Peach has a grandmother, I'm making this up, my mother is very nice and stuff, but she'd be like, don't use me as an example, who doesn't fully endorse, right, my parenting methods. And so it's important for my clinician to understand the constellation, the peanut gallery and the constellation of things around my specific family. It's not just Peach, it's introducing a neurodiverse lens into a family. It's the only thing that has to change is everything. Kind of thing, right?
Oh, just that. Okay.
Just that.
Yeah.
They say that in AA, and I always love that because it's so accurate, right? One thing, all of it.
Love that. Let's bring you all into the conversation. So questions for Robin and Avela. And as you're thinking of a question, maybe I'll just ask, it's really easy at this moment. We see this with every new technology wave, that it's really easy. And I think MIT just came out with a study and a report and a survey that showed a lot of businesses, a lot of their AI projects are failing. They're not delivering. Yeah. And so what's an piece of advice you would have for founders as they're trying to figure out what's the right pilot to start using AI for?
Gosh, it's such a hard problem. And I would turn it back on you. I'm curious. Yeah. Yeah, flipping it, boomerang. But no, it's such a hard problem. I think I'm a first principles person, and I think drilling back into the basics is really critical. Like AI should just accelerate the roadmap you previously had. I think it's easy to bolt AI onto something and be tempted by like the valuations we're seeing, or et cetera. But again, it's hard to put parameters and corners on something that's available to all of us, that's relatively open source, which is the exciting promise of AI because it smashes the gatekeepers. At least that's how I think about it. So I think forgetting about AI and grounding down into first principles and then using AI as an accelerant of your roadmap already is really critical. And I think that actually applied to blockchain when we were also excited about blockchain in healthcare, which I still don't totally get. And then I think it applied to the internet, or whatever, right? Like it's kind of the same. Like you have this common denominating thread.
Great, Anchor. Questions for Robin? There's sorry, it's a blinding light.
When you mentioned like healthcare partners and whatnot, it kind of sounded, how did you find the stakeholders as being a founder, like the stakeholders to make it work? Did you need to go first to a hospital? Did you need to go first to like an insurance partner? And do you see that kind of as a trend throughout? Like, is all insurance partners pretty much the end stakeholders because they're the ones paying, I guess?
Yeah.
How do you differentiate who and what?
Yeah, that's a great question, because you sort of just casually said, oh, well, we built this with a pair, but that's hard. So like maybe talk a little bit about how you did that intentionally and how you built that relationship too.
I think it's not just me, it's definitely a team effort. My co-founder and I started Workit together essentially 10 years ago. So we had already had relationships, but even if you have relationships, healthcare, has such turnover that you might know the chief growth officer somewhere and then they leave to do something else. So like it's not really, I think you gotta go with a really good open and shut cost story, especially in today's market. So if you don't go with like something that is defensible and that understands at least some preliminary actuarial analysis against your offer. I'm talking from a really specific vantage point, but I think it cuts across all kind of platforms. Like you really got to go with like a really open and shut case. I made something that was basically hard to refuse for the health plan partner in my head, obviously, and it helps to be a designer because you can like kind of sculpt it beforehand. But I knew that I wasn't gonna, like, you have one shot at the hoop. Someone said that today, and I was like, that's a great metaphor. So you have one shot at it, right? And like make that shot really count. So that's my advice. And then appeal to humanity. The thing is, our stakeholder at the health plan I mentioned and the others that we're starting to partner with, they are all parents. And so I always start with this, and it started the same way today, but I always start with that humanity and say, like, 30% of kids now are autistic, like a quarter of them are neurodivergent. So you start there, because probably someone sitting there has gone through something similar to what you know, you can appeal to their reason and their basic compassion for themselves and others, so.
Great.
Yeah.
Well, will you join me in thanking Robin?
Thank you,
Thank
John.
you for everything
Thank
you
you.
did. So, great.
Okay.